Hey guys, Dr. Mike here, Oak Brook Medical Group, and we're going to be talking about this very important thing right here, this cervical spine or your neck, the bones in your neck, but more importantly, what I want to cover, because I have to chat with patients about this all the time, and I get a lot of questions because I think it's something that we should all understand a little bit more, but it's more so that curve in the neck. So there's 4 different types of curve you can have in the neck. This one right here, which is called lordotic curve, that's what I want to see. When we look at an x-ray and we look at the bones in the neck, we should see a smooth C-shaped curve in there. What that smooth curve is going to do is actually relax the muscles in the neck. It's going to relax that spinal cord. This is the way it's supposed to be because it calms down everything in the body and allows you to your brain to communicate to the rest of the body the way it is. Now, unfortunately, what we're seeing more and more, and I even see this in kids because they're all looking down at iPads and on their cell phones. I know you guys don't ever do that. It's the little kids that do it, but we're starting to see straight necks. So hypolordotic curves there. So now the neck went from smooth C to perfectly straight. And when that happens, when we go from this to perfectly straight, what you're doing is you're actually taking all that muscles in the neck and the spinal cord and you're stretching it out, putting tension on it. That's the person that comes in to me and says, hey, look, I got really tight traps, but if I get a massage, I feel really good. But then it kind of comes back the next day. Why is that, doc? And it all has to do with the fact that we've lost that curve. The next thing you can do when we go from this and it starts to get worse is you can have what's called a biphasic curve. It's really hard to do this on this one, but it's basically 2 curves. Think the lower part of the neck is going to start to go straight or opposite, and then the upper part's going to have that proper curve or vice versa. But you kind of have an S-type shape in your neck. This one probably more indicative of like, hey, you're in a car accident, some type of trauma, things like that. But again, it's putting a lot of pressure and tension on that spinal cord. Then the last one is we go fully reversed. So now that curve, instead of being C-shaped here, you're starting to go to the opposite direction. This is unfortunately becoming more and more common in the office, and this is one of the reasons why we're having this video and this conversation right now. I want you to realize that as that head goes forward, this is that person you see walking around and the head's way out here. This is going to put a ton of tension on that brainstem, the spinal cord, all those nerves coming out. Patients will tell me, hey, I get this numbness and tingling into my hands, like it feels like pins and needles. That's one of the things that we got to pay attention to, and this is why we look at the neck. So how do we restore this, right? Say you are sitting in this position. What can we do to help this? That's where this little guy comes in. So this little dental roll, we've made videos on this before. If you guys go back to our YouTube channel, take a look. But this thing is specifically designed and patented to help introduce curves back into the neck. All the ones you see on Amazon, not the same. They do not have the science and the research behind them like this thing does. But just to kind of show you briefly, we lay this down on the table. The patients, we tell them it's nap time, right? Starts at 3 minutes, builds up to 10. And what they're going to do is they're going to lay down on this guy, and it is designed to help force that curve back into the neck. So that over time, as you repeat this, now we can think braces on teeth. We're going to rebuild that curve. We're moving muscle, ligament, tendon, bone, all of those things. So it is more of a process, but this is one of those things that's going to help long-term get this corrected for you. So if you have questions, you're wondering, hey, what does my neck look like? Give us a call at that number below. We're happy to take a look. We're here to help you, and we look forward to seeing you in that next video.